Welcome to Health Issues. I'm your host, Chris Sylvain, and we're excited to be here today, and definitely excited that you're watching, and we appreciate you so much. We have an awesome show for you today, and you know, hey, nutrition, and how much we love and enjoy it. But we have a great guest. This is really first and one and only Chef Leah Sarris. She's a program director at the Goldring Center for Culinary Medicine at the Tulane University School of Medicine, the first chef employed by a school of medicine. Am I right about it?
It's true. We're really excited about it.
All right, give me some background.
Sure. So this program started at Tulane almost 3 years. It'll be 3 years ago in March. So it started in March of 2012. And we have a few goals. One of our goals is to teach medical students about nutrition through hands-on cooking classes with the goal that they'll be able to talk to their patients about nutrition and in terms of food and about what they're eating and how they can make small changes to the way they eat to make large impacts on their health. Along with that, we teach free community cooking classes so that we can bring the med students in and they can, we can reiterate those lessons that they're learning and into real world practices for them, working alongside the community members to do it. And another big part of that is tracking the research to see if what we're doing is actually making an impact in both the knowledge, the attitude, the beliefs of the physicians, but also with the community members, and are we impacting their health as well?
That's a good study.
Yeah, it's a lot of studies, and we're really just starting to delve into that. But you know, there's not really any research done on teaching kitchens and the impact of doing this hands-on format and how it's going to change people's health in the future. So
I would think that that is amazing. Yes, it should. I mean, you know, we wait for the data, but I can't see how it. To me, that's the key to unlock the door.
Yeah, we have high hopes that the data is going to show that what we're doing is making a large impact, a positive impact. You know, but at the same time, we are evidence-based. We do evidence-based practices, and if in 5 years what we're doing is not shown to be making a positive impact, and if we can't change it to make a positive impact, then you know we're prepared to walk away. But we don't anticipate that's going to happen. It looks very promising as of now. So,
well, I mean, all right. Let's be clear. If people change the way they eat, that's proven that they will change their health.
Yes, absolutely. There's no doubt about that.
Okay.
I think the up to date, you know, a lot of people make short-term health changes. I think the real difference is not just, well, one, in the long term, how does this impact their health?
Right.
And actually teaching them to cook. How does teaching them how to cook impact their health? And then the other part is actually teaching the physicians, how does that message get conveyed, and does it help their patients to make more positive changes?
Hey, and that's, I think you hit the nail on the head there.
Yeah.
How you say the patients, once they figure out how to cook it and it tastes good, there's nothing stopping them.
That's what we think, yeah, because a lot of it, you know, just me telling you what to eat, you know, you need to eat less salt,
right,
or you need to cut down on your saturated fat. To people that seems very limiting, and to them it seems like a diet that people think of as a diet where they don't get to enjoy foods they love to enjoy. And I think when we can show them ways to do this and show them ways to make their food taste great and still get to enjoy the things they enjoy, but in moderation, and that it doesn't have to be what they think of as a diet. It doesn't have to mean they can never, ever enjoy foods again. I think it's much more approachable to them, and they're much more likely to be able to take this up as a lifestyle rather than a short-term diet.
Well, I give you, for instance, I never forget, you know, and truly I call him a mentor and friend, Gil Copeland, you know, worked with Al Copeland's brother. And I never forget, he was saying, Chris, you can't tell them it's healthy. They'll never eat it. You know what I mean?
Yeah, it's true. And the research is very clear about that. There's a lot of great research that if you menu food as healthy, one of two things is going to happen. one, people are already dissatisfied before they even eat it.
Right.
Or two, they assume they can eat more of it, and they do eat more of it. So there's actually a great book that points out a lot of this research that's about it's called Mindless Eating, by Brian Wansink, and he's done a lot of research on this type of menuing, just as an example to see how it affects what people choose. So our message is, it's about making great food that just happens to be good for you. And what I try to emphasize to the public, to chefs, to restaurants, because I do think this is something that a lot of people perceive they need to say it's healthy, but I try to push them to not say it's healthy, just make great food that just happens to be good for them.
Well, now, so that's where, to me, you're the key, all right? I call it that from, not you personally, but this particular position of a chef that understands health. Mm-hmm. Because from the medical side, it's pretty hard to take that white jacket and hide that you're trying to make it healthy or not.
Yeah, I think the great thing about food is we can all relate to food. We all have some kind of connection, whether that be familial or, we might just love food, but we love certain kinds of food. We all need it to survive. We need food, but we want to enjoy good food. So I think from the chef perspective and the food first perspective, it might be a little easier for people to chew, literally.
They'll listen to you.
Yeah, and chefs have been a little glorified in media, so the white coat helps a little bit. That white coat.
That white coat, yeah, the other white coat.
Yeah, I think people kind of have that perspective of chefs that helps be a little more successful in teaching them about nutrition and health.
But let's even delve in that. The mind of what people call, when somebody looks at a chef, it's a whole different thing goes on in their mind, a whole different type of conversation. It's a whole lot more enjoyable. Mm-hmm. When they see a doctor or a pharmacist or whatever, they're like, I got to deal with you. And I really don't want to. But
yeah, because most people associate food and eating and cooking with joy and family and happy times and holidays, and think of people like Julia Child and Martin Yang. And so food is a joyous occasion for people. We're going to the doctor. Unfortunately, we've come to this society where it's usually to bear not so great news, but we're trying to take it to the perspective that we can be more preventative and help them not get to that spot. So the doctors can actually take a more active role in preventative health, and maybe we'll start to change the way that people view those doctor-patient interactions as well, because it won't be all bad news and you need to change. But with food, it's, hey, let's talk about food. You like food, I like food, let's talk about food.
That's good though, but and that's, I guess that's my question. Mm-hmm. From the medical perspective, there's only so much people are willing to receive from the medical perspective. That's the point. They don't want their food to be kind of healthy like that.
Yeah, and I think that's part of the disconnect is, the way that the medical field is now is largely about treating conditions, and they're prescribing medications as doing such. And food has gone out of the discussion, and that's why I think people don't want that. But, now that we really understand the intricate way that food is involved in our health and our health outcomes, I think we need to change the way that people see that. We need to bring that discussion of food back into it and let people see that they're not disconnected. They really are very closely interconnected. But there's a way of doing that, showing people that food can still be a joyous occasion. You can still enjoy these great, delicious foods and have a positive impact on your health all at the same time without just relying on medications, live longer, healthier lives in the process. So, this is a culture change, and it's just starting here. I think we're just hitting the tip of the iceberg in many forms of nutrition and health and the connection to what we eat.
Well, and you hit the nail on the head that historically cultures blended the two. Mm-hmm. It's only
and then we lost it, you know, in the days of processed foods and convenience foods and busy families and just the availability of cheap, unhealthy food. And people don't know how to cook anymore. You know, that's an art that's been lost. People are afraid to get in the kitchen and try something. So I feel like a lot of what we're doing and what I do in our cooking classes is just giving people what I call kitchen confidence, getting them the confidence to go in the kitchen and just pick up a knife and pick up a recipe and don't be afraid to just try it, because it's not that hard once you get going.
Well, let's start talking about that.
Sure.
Let's delve right into this concept of how do you cook food, all right, that's healthy and people can still rub their stomach when they finish eating.
Sure. So, I mean, I could go on about this for days. I'll try to keep it as concise as possible. I just want to mention, before I start talking about specifics, that I don't believe, and we don't believe, that it's just about the food, but it's also largely about meal planning. It's also about reading nutrition labels, portion control. You can have all the best intentions, but if you don't have a plan, those intentions will never come to fruition. So I think that's an important part of what we teach are the other small pieces that go along with that. Along with that, I think it's the time, lack of time and budget, and we gotta help people overcome these perceived barriers to eating well. So that's, people think that to eat healthy is expensive, that it takes a lot of time, and that they have to eat small portions, or that it doesn't taste good. And we have to break down those barriers one step at a time. We talk a lot about the Mediterranean diet, and I do sometimes hesitate saying, because people think of Mediterranean and they think it's Mediterranean food, first of all, and they hear diet and then they automatically think it's something that is going to deny them of foods they love. But it's not actually about either of those things, it's just about incorporating these 9 simple concepts into whatever type of food it is that you like to eat. And the reason we follow this is because there's a ton of evidence to show that people following this way of eating, no matter where they are in the world, it's just not about the Mediterranean countries, but that's where we first noticed this phenomenon, and that's why we named it after the Mediterranean, because we started noticing it in the Mediterranean cultures, we studied it, but now we've noticed that anyone in any parts of the world that follow these principles live longer, healthier lives. So there's 9 points of that, but a lot of things that I focus on, vegetables. And you hear a lot, eat more vegetables, eat more vegetables. But the way I talk about it with people, people automatically think they have to eat a salad or a pile of broccoli with every meal they get. But I try to teach people ways to incorporate vegetables more into dishes that they're already making. So here, jambalaya, red beans and rice, gumbo. Those are actually great examples of things we can cut out half the meat, which is another goal, lessen the amount of saturated fat and of meats. Cut that out, add a ton of vegetables. You've actually saved money by doing that. So there's another barrier that we broke down, the perception that it's going to be more expensive. Incorporating maybe some beans into some of these dishes. But we teach people to do this in ways that, and we build flavors. So we're not just focusing on adding salt and fat on top of these. Let's talk about seasonings and spices and herbs. How about how adding acid can help to brighten flavors without just relying on salt? So we teach them these concepts, and I'll just give our first class, it's a perfect example. We make spaghetti, very common comfort food. We've all eaten spaghetti at some point in our lives and can relate to spaghetti. And we make 4 versions of it. And the first is kind of the version that you probably grew up on. You take some pasta sauce and a pound of meat and maybe an onion on white pasta, and that's it. Call it a day. But then version 2, we cut out half the meat. We incorporate more veggies. We add a lot of mushrooms. The mushrooms help to give us, we chop them small so they give us the texture and flavor that the beef was giving us. So you can't tell from looking at it or even tasting it that half the meat is there. We've saved money. We've put the other half, the beef, in the refrigerator or freezer for another meal. Version 3, we actually start incorporating lentils into the sauce, which is interesting. And we know there's a lot of benefit in eating legumes or beans and and a lentil is a legume. They cook really fast. They have a ton of fiber. They have a lot of iron, a lot of protein. So we add those into the sauce with the beef, with the mushroom, with the vegetables. And then version number 4 is just a lentil sauce. It has no beef in it. So we're showing people 4 different areas of the perspective. And I think that something that's important to note here is that there's no one way of eating that's right for every person. You know, some people it's right to eat vegetarian, but it's not necessarily realistic for us to ask that of the whole population.
That's right.
But if I can show you ways of cutting down meat, and maybe you're willing to eat more vegetarian meals because I've shown you that it can actually be very flavorful and filling, and what do you need to actually make it be filling? You need protein, you need fiber, you need some fat. And if you don't have those things, it's not going to be filling. And those are the kind of concepts we're teaching. But across the board, we plate one portion of these spaghettis, and they vary from version number 1 to version number 4. All of them are at least 2, 3, and 4 are at least 100 calories less for the same size portion. But some of them are up to 160 calories less for the same size portion. And it more than doubles the fiber in a lot of them, which helps us feel full. It's good for our digestive health, lowers our cholesterol, amongst other things. So we're just taking something that they're already eating and making small changes to make it better for their health. And that's the kind of concepts we tie into everything that we're doing in our cooking classes.
Question, could any of that not be demonstrated, to explain all of that without people being able to taste it? Is it like 2 different worlds?
It is. You know, I think people are willing to listen and try it, but when they can actually taste the food, it's a very, you make more of an impact, because I tell them this, and it sounds weird to them. If I told you, here, have this lentil beef sauce, most people would look at me like I was crazy and had 3 eyes. But if I say, here, look at it, it doesn't look bad, let's taste it.
Right.
And usually they're like, wow, I'm pleasantly surprised.
Right.
Giving them the opportunity to actually look at it and put it in their mouths and bellies is much more, I think, profound for people. Has a much larger impact.
But I think you said it before, though. There's so much more to food because there's a relationship. Hey, somebody great. Hey, I mean, you're chef. Restaurants. That's what makes a good restaurant.
Yeah, it is. It absolutely is. But at the same time, I've talked with another chef from Johnson & Wales, he was a dean of the culinary school that we partnered with this, and he made a really great point. And I agree that as chefs, we are feeding the world, and I think we have an obligation, a moral obligation, to positively impact the health of our patrons. We're taking care of these people. We're feeding them. We can't just consider taste. We have to also consider the impact on their health that we're having. And right now, it's not working out very well. People are. For the first time ever, kids have a shorter lifespan than their parents. And I think we're starting to see changes reversing back in the other direction very slowly because of a lot of different programming that's going on around the country. But we have to stop thinking about it. It has to be more long-term than the immediate impact of someone eating a meal. And, how can you feel good about what you're doing if you're negatively impacting people's health and therefore their lives and their livelihood? And it's not just their own health, but we've all been impacted by someone in our family who was sick. Whether that's maybe someone who has diabetes that's lost a leg or has lost their eyesight or just has a hard time controlling it, or someone who's had a heart attack or maybe even has passed away from heart disease or heart attack. It impacts us all, and it impacts the family, and we need to start approaching it as such.
I think that is a revolution. That is an awesome movement. I mean, imagine if that can take hold, the movement of chefs, of cooks, of, with moral authority.
Yes.
Around my house, I always tell people, we're not drug dealers. Don't bring those things into the house. You know what I mean? It becomes, because if you're going to damage people's health, can you really care about them?
It's true. And, I think a lot of what I'm teaching is also their parents. They're passing down these messages to their children. And, as a parent, you have to decide, do you want to continue this message that is harming the children? Right. Or do you want to help to be part of the change that's helping to help them lead longer and healthier lives? And I think all parents will agree they don't want anything bad to happen to their kids. They want nothing but the best. They want them to lead long, healthy lives. So we have to start somewhere. And I think chefs are catching on to this as well. You know, there is a shift happening. We're just at the beginning of it, but I talk to chefs all the time, and I'm very thankful for that, who are willing to have and want to have this discussion. And a lot of it is just the education for them too, because people have these preconceived notions about what healthy eating is, and we gotta kind of break that down piece by piece and help them understand what nutrition and eating well really is, and that it's not about food that's bland. It's not about boiling and steaming everything till it's falling apart and mushy. It's not about never adding salt. You know, we got to show them you can still have the best of both worlds and positively impact someone's health at the same time.
I am thoroughly inspired. You know. I mean, everybody. I don't have to talk about it. I love the whole concept, the area, but to listen, because now from the medical side though, they're just given the information or the ammunition to really have this discussion. I'd say it's been no more than maybe 5 or 10 years.
Yeah, no, it's I don't think it's any secret that the nutrition that anyone in the medical profession is taught is fairly limited, and it's not really in terms that the patients can relate with, like with food, for example. You know, they're more about nutrient interactions. They're more about from your perspective, a lot of drug nutrient interactions, about deficiencies, but it's not, let's talk about what you're having for breakfast and how that might affect, your cholesterol levels. So they can start, and what we say is we're teaching them how to have this conversation with patients with short, simple messages that they can repeat over and over again with their patients, and not over inundating them with information. Change is a slow process. We can't overdo it and push too much on people at once. But, how can we start that discussion? Let's start by doing a 24-hour dietary recall. What did you eat for breakfast? Okay, you're eating that Jimmy Dean sausage biscuit. Are you willing to do this? Do you like eggs? Do you like cereal? Do you like oatmeal? What are you willing to do? What compromises can you make? And finding something that works for that patient. Not to replace the dietitian, because the dietitian is absolutely appropriate in a lot of ways. But a dietitian also isn't always an option for a lot of people. And you might be able to make an impact before it gets to that point where they need one as well. So,
wow.
Yeah, we're excited.
Yeah. I mean, literally, because again, from a chef's perspective, it's a whole different office. When you think about the chef's office is the kitchen.
Yep.
And not that chefs don't have offices, what I mean? In big restaurants, they do, but you think about it, it's a place, as you said, we started off, people, they want to be a part of the kitchen.
They do. And, learning a new skill is exciting to people. Okay. Most people that I talk to, if I say, do you cook, or do you want to know how to cook? Do you want to know how to cook better? The answer 90% of the time is going to be yes. Right. And most of them just don't know how, and they're too intimidated to try. So we're just, we're working alongside them and walking them through it, and they can see it's not so intimidating. And I had a woman that was in her 50s that had never cooked a meal for her husband in her life. She never cooked a meal, never picked up a knife, because she was scared to try. He did all the cooking, and while she was in our class, she cooked her first meal that she had ever cooked for him. Oh, wow. Or he would cook, and she'd say, I'll do the chopping. Now her knife skills are better. So,
wow, that's a great man.
I love these stories, and it just makes what we're doing feel so much more important, and it is starting to catch on. Actually, 9 other medical schools have licensed our curriculum across the United States.
Super.
And we're in conversation with about 6 more. People see this need, and they're excited to jump on board. It's just someone had to get it started, and we're excited to do it here in New Orleans, in a place that, our health disparities here top the charts. The country's bad off, but we're definitely at the top of that. So we figure if we can do it here, it can probably get done anywhere.
Literally, because the standards for food are very high in New Orleans.
Food culture here, and that's a discussion I have a lot. There's such a heavy food culture, and we don't want to disrupt that, or we don't want to push against that. We would rather embrace it and bring it into the discussion. But it's also, you have to tiptoe, because historically, more recently, historically, not always, but the food here tends to be very heavy, very, a lot of fried, a lot of butter, a lot of salt. So we got to figure out how to work with that and help people still embrace, the food culture that we have and the availability of ingredients that we have here, but do it in a way that's going to more positively impact their health.
Something we say all the time, a highly skilled chef can make it taste good and still be healthy.
You're absolutely right. You're absolutely right.
Bobo the chef couldn't do anything. I mean, he just go in there with a bunch of salt and whatever, you know what I mean? But a highly skilled individual is able to bring those tastes together, and takes training.
It does take training, and probably not as much as people think. I think, once you get these simple concepts down, anyone can take them into their kitchen, and that's what we're trying to get people to do. Is just learn these things. If you don't want spaghetti, how can you take this, adding more vegetables, cutting down meat, using whole wheat pasta. How can you take this into things you are eating the way you do enjoy eating? And I think people always find a way to manipulate, the messages that we're giving so that it works for them.
Well, the response. How's the response?
It's anecdotally, it's been great. We're doing the research to hopefully prove that we're actually making a positive impact in these people's lives, and it's a little soon for us to tell what the results, although it's looking very promising. Anecdotally, though, people hear community cooking classes, and then they hear it's free, and then they hear they're learning about nutrition and how to cook, and people are pretty excited to join. I've been waiting for this new kitchen that just opened 3 months ago, and I've had a waiting list of over 100 people that we're just starting to get to chip away at. So, word of mouth is caught on.
Hey, you can't beat free. Chef Sarris, we thank you so much. Hey, eat healthy, work as hard as you can. Believe me, you've been designed with a purpose. So enjoy who you are. Have a great day.
Thank you.